This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about when to avoid back surgery. And by back surgery, I mean surgery of the lumbar spine. Now, I'm sure if you have back pain or you know someone who has back pain and they've had surgery of the lumbar spine, you probably have heard someone say, yeah, I had pain in my back, I got the surgery and I've been terrible, and then they did much worse. So the question is when you should avoid it. So what is back surgery good for? So if you have a disc in your back or some arthritis and it's causing one of your nerves to be really pinched, and pinching of the nerve is causing pain going down your leg, and you have a lot of leg pain, that can be reliably fixed with back surgery, meaning that they'll go in there and they basically fuse that level and they take the pressure, they decompress the nerve, they take pressure off the nerve, and you can reliably get rid of your leg pain. Now, this is also true if, let's say, you just have a disc out and they go in there and they just remove that piece of disc. It can be good. So if you have leg pain and your leg pain is what's killing you, pain traveling from your back down to your leg, sometimes all the way bottom of your foot, and you failed everything else, that can be when back surgery will be good for you or will help you, because we can reliably take pressure off those nerves and you'll reliably get better. Now, the question is when to avoid back surgery. So if you just have back pain and you don't have any pain traveling down your legs, we'll call that non-radicular pain. It's a crapshoot whether you're going to get better from back surgery. There's so many different levels of the spine, there's so many different areas, it's hard to know whether all of your pain is just coming from one or two segments. And when someone does surgery on your back for pain and they fuse it, are they really fusing the right levels, or do all of the levels hurt? And I think that's why you see a lot of people who have failed back surgery. It's not because they had leg pain, it's because they had back pain, they failed physical therapy, they failed injections, they failed medications. And the next step is like, well, I guess we can do surgery, and then they just do terrible. So a good spine surgeon will mostly operate on really leg pain rather than back pain. So if it were me and I had really bad back pain and I failed everything and I didn't have any leg pain, I would not get lumbar spine surgery. There are different instances, of course, where like somebody has some instability where maybe one vertebrae is moving on another vertebrae, or you have scoliosis or different stories. But by and large, for most people with back pain, you get the surgery for leg pain and you avoid it for just back pain in particular. If you stick to that, most people are pretty happy with their back surgery. I've seen it before where somebody could barely walk, and after the surgery they're walking much better just because those nerves were just pressed on so bad. So that's in a nutshell when you should get back surgery and when you should avoid it. I hope I was able to answer your questions about when to avoid back surgery. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. The caveat is that I can't respond to your specific medical situation or what you should do in particular, just about the topic in general. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.